broadband. So if people use less video, then we don't use too much broadband, and it makes it better.
Okay. So while Edith gets ready, I'm going to use this time to welcome all of you. And you have received the housekeeping. And so I also thank Edith for mentioning what that is. While we're waiting, I would also like you to keep thinking about the burning question that you may have to ask the panelists as the time comes. But I would like to ask, before we start, to just pause for a few seconds to remember the people who have lost their lives, not only in the United States, but around the world. My heart goes out for them, and I know yours as well. So just if we can just take a few seconds to be silent, to just remember them. Thank you. Thank you. Thank you, everyone. I think our lives have been upended in many ways, but at the same time, I think I can tell you I'm very grateful that I am safe with my family, and my children are here, and I hope yours as well. But there are people suffering, and we just have to keep thinking about them so that we don't think this is normal, because it is not. And I want to thank each one of you for being with us. My name is Almaz Negash. For those of you who are joining us for the first time, I am the Executive Director of the African Diaspora Network, and I'm delighted that you will be with us today, because we need to be together regardless of what the means is. And especially this morning, because the issue of healthcare is exactly what we are talking about and what our people are suffering from. So I'm very happy that you're here. If you don't know about the African Diaspora Network, I encourage you to check our website. But our real goal and mission and purpose is to bring Africans and friends of Africa together to find ways to not just only to collaborate, but to connect, to learn from each other, and to find ways to make a meaningful impact in their own lives, that of their community and that of their community, regardless of where we are. The diaspora is a reflection of where we are. And so I am here in Silicon Valley. This is my community. And I am also always drawn to the continent where I come from. Originally, I'm from Eritrea, but I belong to the continent. In many ways, I belong to the world. So do we. And I thank all of you for being with us. And what's going to happen is Edith will take over. She will be running the program this morning. And at the end, we will come back. But I just want to say a little bit about Edith, and she will be introducing the two speakers, Josh and NDA. Just as full disclosure, Josh and NDA are on the board of the African Diaspora Network, and Edith has been an advisor, an executive advisor to the African Diaspora Network for the last 2 years. I have known Edith to be an incredible thought leader, an amazing person who brings, between 1,500 and 2,000 people every year through the global challenge that the Gates Foundation has been running for a long time. In many ways, that the foundation has been telling us for what we are seeing today. They had the vision and the foresight to predict what we are going through today. So having Edith today with us actually would bring so much knowledge and a little bit of not necessarily comfort, but at least in knowledge and knowing that there are people who care, and that we will do what we can to make sure that we contribute in any way to make sure our community, whether here or in Africa and other places in the world, are supported. With that, I'm going to give it to Edith. Edith, thank you. Edith, are you there?
She's still trying to get on.
Okay.
Sorry, you guys. So I'm back again.
Okay, I just did my intro. It's all yours now. We talked about you behind you, so you have no idea what I said.
I'm glad. I'm sorry. So it looks like I'm back again. And I see my two panelists. So good morning, good afternoon, everybody, and good evening, wherever you are. We are grateful that you have joined us. Apologies for some of the technical difficulties, but I hope that Almaz has framed the conversation. For me, I want to open with one quote that really feels it sums up our current reality. It reads as, "This is like a world war, except that we are all on the same side." And there is a comfort that comes from that, at least for me, knowing that I am a part of a global community faced with a common enemy and working together with all of you and the entire global community to defeat it gives some sense of comfort. So as Almaz may have mentioned, my name is Gaddis Tesfagiorgis. I was born in Ethiopia from Eritrean parents, with siblings living in Europe, Africa, and the US. I'm sure like most of you, I now live in the US. And again, my friends scattered all over Africa, Asia, Europe, North and South America. So truly, this touches every aspect of my personal life, as well as my professional life. So our world is in a way turned upside down. Last week, as we were preparing for this conversation, my fellow panelists and I felt like that we have a dual responsibility, really, supporting our two homes, the communities where we live, wherever we are, and supporting the African continent where we are from. So this conversation is in a way as dual citizens in this massive planet of ours. So we're asking ourselves, what is our role? What are our responsibilities in this dual role and dual citizenship that we find ourselves in? What is the short-term situation? What are the long-term plays? So we've seen over the past few months what COVID-19 can do in Europe, here in the US, with countries with relatively strong health systems. As the virus threatens to accelerate in Africa, it's clear that more resources must be channeled very, very quickly to prevent death and limit the social and economic impact of the disease that's going to follow us for years, maybe decades to come. So doing so will not just help Africa, it really help the world as we know it. Because again, another favorite quote of mine is, "Pandemic anywhere is a pandemic everywhere." So the conversation really highlights on the importance of science and innovation and the citizenship that ties it all. We need innovative new tools, approaches in both testing and treatments and long-term vaccines, and of course, policies along with behavior change, and we all need them very, very urgently. Already, African innovators across sectors are driving efforts that gives all of us hope. And globally, innovation is happening and scientific collaboration is happening at record rates, which is honestly one of the happy outcome of this situation. However, there is much more to be done, and unprecedented global pandemic calls for unprecedented levels of global scientific collaboration alone won't fix it. So thrilled to facilitate today's discussion. It's bringing to global experts to really start talking about it and trying to understand it, and we'll go from there. So two panelists, Josh Gam and Ndie, thrilled and really happy to be part of this conversation with you both. So I asked all of you to help me welcome Josh Geim. He's the founder and managing partner of Ignite GB and co-founder and CEO of Small World Brands. He has many experience, including as Chief Technology Officer of Johnson & Johnson family for over a decade. So welcome, Josh, and thanks for joining us. And of course, Ndeye Makalu, she's the Global Commercial Supply Strategy Leader at Genentech Rush. We absolutely need your expertise in the biopharma industry from over 20 years, both in health. She's a healthcare professional, but she also is just all of us here, part of the African diaspora, trying to help us understand the situation. So, should be a fun discussion. Again, as I have said, after we hear from our two experts, we're going to open it up, and Almaz and her team will help us tee up the conversation. So welcome again to my two panelists. Before we dive in, I want to ask, how are you doing? It's a challenging time on many different levels. We're balancing work and home responsibilities while worrying about everything around us. So Ndeye, to you first, how are you doing? How are you coping up?
Thank you, Edes. Good morning, everyone. My name is Ndeye Makalu, and I'm really very honored to be here to discuss about this very important topic. Thank you for the question. You know, as you have mentioned so rightly in the beginning, this is unprecedented time, and we're all trying as much as we can to adapt and to deal with the reality. You know, like from a family perspective, yes, we worry about it, and you have your kids in the house, and they're trying to understand what's going on. You also have your work responsibility. Some of us have the opportunity to actually stay home and working from home using technology, like what we're doing right now using Zoom. So it's been really good from that standpoint, and I'm grateful that I have that and I have my job. And as much as that it's difficult, and then we are all concerned about, you know, where we're going, the direction that we are going to. At the same time, I feel a lot of gratefulness, and I try to just like managing the household and managing the work at the same time, and making sure that, you know, I have like a fine line in between and separating them, which can be a challenge sometimes. But in the meantime, you know, it's wonderful, and we are just like trying to adapt. So yeah, that's how I'm dealing with it.
Thank you. Sounds a balancing act, but thanks for sharing. So Josh, how are you doing?
Doing good. First of all, thanks for having us. I think this is great. Yeah, it's interesting because first of all, I think we're fortunate in terms of where we are. We live in Princeton, New Jersey, so having the kids at home, actually they're happy to be home because they don't want to go to school. So it's a little bit, they have a different incentive in terms of my kids are 12 and 10, so that's a little bit different. But it's interesting because if you start with the kids, and every day basically they have schoolwork that they still have to do. But it's interesting, I was talking to them this week and I said, did you miss going to school or just hang out with your friends? He goes, oh, nothing has changed. I still play with my friends online. It's just, they were already adapting to this kind of a system. But again, I think it's, you always have to balance that with people that are suffering, that don't have that kind of access that we get to have. So we got to keep that in mind. I think for me, the situation actually, granted, I've been in the consumer health pretty much my whole career, whether it's Pfizer or J&J. It's interesting to see how you start to think about what's more important, what's more relevant. I think these are situations that I know we're not very good at as humans. We tend to react to things and then we forget about it as soon as it passes. I just hope that this is so different. This is so dramatic in terms of its influence, the fact that it doesn't differentiate. Seriously, I've been involved with, I grew up during the famine in Eritrea and Ethiopia, where a lot of refugees were going to Sudan and others. My mom used to work for the Swiss Red Cross. So we've seen a lot of different tough situations, but this is everyone. It doesn't matter where you live, what you do, somehow you're going to be impacted by this, whether it's how you live or just the true situation of being infected. So I hope this is going to be one of the biggest lessons for each individual. I'm not even going to get into governments and companies and everything else, but as individuals, what's important to you, what's important to your family, friends, what's important to your coworkers. I think there's an opportunity to just leverage what's happening now to bring things together and not forget and just move on after this slows down or things like that. So I think we're doing well. I think it's happen to be fortunate where we live and what we do. Still have jobs, still have the situation that we're in is manageable, but we also have to recognize that this is a big opportunity to change how healthcare is delivered, how healthcare is addressed, and also just being prepared. A lot of times we tend to forget.
Yeah, so true. I mean, it's interesting to hear you say, because one of the things early on that I didn't really fully recognize is that I also grew up in Ethiopia, having sort of a different experience that I don't want to say that prepares you, but you're sort of aware of infectious disease, right? But as I was talking to my friends who grew up in the States, it occurred to me, it is really hard because they don't have that kind of knowledge. I mean, you read about it, but living through it is a completely different experience. So for me, it reminds me that I need to share what I know from growing up in places in Africa where infectious disease is actually a daily occurrence for people. It's just not at this level. But sharing that with my friends who didn't had that mind frame to really understand what it means to live under the threat of an infectious disease. Sharing that with my own kids who have grown up here and they have no clue what it's like. So it is an interesting role that I find myself playing because, wow, I actually know a little bit more about this because of the exposure and just by growing in areas where infectious disease is a daily occurrence. So I think it's an opportunity to share what we know, to open up another channel of communication. So to go back to your point, Josh, of when this is done, and it will be done, and it will be behind us, that we deal with pandemic in the future in a brand new way, because now we have so many more allies that have much more understanding of what it means to live under the threat of infectious disease. Okay, well, so let's dive into why we're here today. So I'm going to go back to you both and in your individual companies and your professional lives. What are your companies doing in response to the pandemic, both globally, but also in Africa, since you both work in that social health, in healthcare and the pharmaceutical background. So we'll be keen to hear your experience. First, I'll come to you, Ndeye, and then Josh. Thank you.
Yeah, thank you, Keres. As you know, Roche, I work for Roche Pharmaceutical, and Roche has a big division in diagnostic and have been playing a very important role recently to have a response to the pandemic. So recently we got actually approval from the FDA for a test that will detect the virus that causes, the COVID-19 disease. So it's really, really very exciting from that perspective. And, we are trying to produce the test and then providing it to the world. That's currently what we're doing from a testing perspective. On the other hand, also that we are also involved into clinical trials, like many companies, as you know, are trying to find a solution to this disease. And one of the things that Roche is doing also is on that end is really to participate in these global phase 3 clinical trials and trying to find the safety and efficacy of certain product, not necessarily for COVID-19, but however has been helping into the treatment regimen of this disease, but we need to test it and make sure that it actually is safe and efficacious. So that's the two aspects from a testing perspective, but also from the clinical trial. As far as, like in Africa, yes, Roche is present in the continent, and we have the platform that is being used to test. And so, those platforms that are into many African countries, were used before for HIV testing, but we also can use it, the panel, for COVID-19 testing. So we're sending the test and using that platform into different parts of the continent where we are present, and to help also with the detection of this virus.
Thank you. Josh?
Yeah, I think, so I spent the last 13 years at J&J and actually left last year J&J, but stayed in contact with a lot of my colleagues there. So I think it's interesting because, first of all, I think it's great to see the progress that's being made. I think J&J announced that they have vaccine already identified. They're going into a clinical trial in September. Actually, they're about to start production at risk of hundreds of millions of vaccines, with the hope that the clinical trial will work, which is, you can imagine when companies are committing to that. And it's not just J&J, it's just across the industry what we're seeing in terms of the collaboration. The only time we've seen this kind of collaboration is a few years back during Ebola, quite a bit when that started. I think there was almost a similar thing. I wish it had continued to address a lot of the collaborations. Everybody goes back into the competitive mode. But now it's interesting because from a timing perspective, since I left J&J, one of the things that we've been focused before COVID was actually this area of upper respiratory disease, which now includes COVID. It's whether it's flu. It's interesting because flu by itself every year kills about 300 to 500,000 people around the world, including about 35,000 people in the US. So we've been looking at this to say, how do you actually prevent infection? Because a lot of times flu spreads the same way that we're talking, maybe to a very different degree, but that's something that happens quite a bit. And especially looking at the US, probably 55–60% of doctor visits are not needed. You could have done digitally, have interaction with physicians. Can you develop diagnostics that you could do at home so that your physician has data to make those conclusions? This is an area actually when I left J&J that we felt, and that's the main reason I wanted to work in this space. And then COVID happened, which actually enhances it even more. I think it's almost being on the other side, which is on the entrepreneurship. You think about things very differently than being in a big company, because big companies have very specific programs that you go through very specific steps. And for us, I think when COVID started, if you look at it, there's almost just four, I don't want to simplify them, but four simple steps that need to happen. The first one being, who are the most vulnerable people that are at risk, and how do you protect them? This could be as simple as hand washing, as simple as masks. Make sure that the simple equipment that's needed is available to protect the people that are at risk. I think that's the starting point. And whether it's in Africa, whether it's in the US, we see it that when they do that, it does work. And I think that's going to continue to be important that countries like Africa are prepared for that. Countries within Africa, in the continent itself. I think the controlling the virus spread, which is how do you detect it? How do you test? I think that's going to continue to be, and the reason I'm breaking it into this four areas is almost you could look at each one and say, how do we innovate to answer each of those questions? So detection, testing, controlling the virus spread becomes the next most important thing. Obviously, it takes time to do treatments and vaccines, even though we're seeing a tremendous acceleration that's happening. I think that's going to be important. And then the fourth one is basically how do you balance health outcomes with economic, because this is going to have even a bigger, even if you find the vaccine, even if you solve, completely eliminate the impact that this is going to have from an economic perspective is going to be huge. And I think it's going to be important that people are prepared for all this areas. for us, I think there's a couple of things. If you go back up to the top two, which is what we're focused on is two things. One, how do you actually detect the virus fast enough? So how do you develop diagnostics? We've been partnering with a few companies that are actually going through FDA approval. But again, you need to continue to make this cheaper and cheaper so that everybody around the world can afford it, not just people in the US or in Europe. It's great to see what's happening in places like Senegal, a $1 test. Actually, I think Senegal is now third in the world in terms of the number of testing they're doing. And it's interesting because sometimes, and I think, Candace, you brought it up with your kids. It's interesting with my kids, when we watch the news at night, obviously you see New York City, the New York governor talking pretty much every morning, California governor talking about what's going on. A lot of complaints saying they don't have enough ventilators, which is true. But then you consider that to what's going on in places like Africa. It's interesting that Senegal had, hopefully it's getting better, but had 50 ventilators in the whole country with 60 million people. So when you consider that, and here we are complaining about having 168,000 or even more, I think we got it, which basically then forces you to think about innovation. What do you need to do? And I think we're starting to see it even in Senegal now. A normal ventilator costs about $16,000 US. They're developing some 3D printed artificial ventilators for $60. Again, I think it's not just for Africa, but it's for the rest of the world, whether it's India, whether it's just across Asia, across Latin America. The opportunity to be able to collaborate and bring those innovations forward is going to continue to be important. I think in situations like this, the other area we're focused not just on testing, but also is the idea of digital health, to give you access to healthcare workers remotely. It's interesting how much in the US, the idea of digital health and telemedicine has been a big idea. But believe it or not, places like Africa have a much higher potential because of people's access to telephones, to smartphones, to Wi-Fi and everything, which is you're able to reach remote spaces. I think we've seen it in Rwanda and other places in Kenya. These things become very important. It's interesting that one of the things that, I don't know how many people are familiar, in China, one of the biggest telemedicine platforms is called WeDoctor. Right now, there's 6,000 doctors in China that actually have volunteered to actually do consultations so that patients would just go online from anywhere in the world and be able to talk to a physician. And I think for me, that's the area that's going to need to change, because there's a lot of discussion around we need more healthcare workers, we need more doctors. I don't think that's going to happen anytime soon. So the question is, how do you open up access, whether it's digitally, whether it's through online system, regardless of where you live in the world? Because again, I'd be surprised how many of the people on this call are actually from a lot of different places around the world. We're seeing that a lot in terms of being able to connect. And for us, it's mostly what we're focused on is, one, how do you develop the testing and the detection methods? And then how do you digitally connect it to a physician when it's needed, so that somebody is helping you look at the data and give you some advice so that you can deal with it yourself.
Yeah, so thank you, Josh. I think you bring up a lot of interesting points. So just to go back to a few things that you have said and a couple of things that Ndie has said. So with digital health in Africa, for instance, as you've said, could be a game changer, right? It could be sort of that disrupting technology that helps population have access to telemedicine, as opposed to actually being in a facility where you need to talk to doctors and nurses. Ndie, you've talked about Roche using some of the HIV work that you've already done for the diagnostics work that Roche is exploring for COVID. There is also an interesting lesson and something that is actually underway that we need to keep an eye on, where the South African government is fighting COVID in an interesting way, where they're using the health systems that they've put in place for HIV/AIDS to redirect it and have the lessons learned and the health systems to fight COVID. So in many ways, we're looking for innovative ways, we're looking for innovation to fight this thing. And I feel like there are some interesting lessons learned and interesting case studies that are bubbling up across the continent, including the the Senegal example that Josh talked about, where Institut Pasteur is leading the way and collaborating with a UK-based company to bring testing to the population, and they're doing an amazing job right now. So, question to you, Nadia, are there some health systems that we've put in place, whether it's HIV, whether it's Ebola, whether it's polio, any of these infectious diseases that were happening and circulating on the African continent, that people are repurposing either the process or the tools and the knowledge to fight COVID? And what are your thoughts, both in your own professional lives, but just knowing this space will be interesting to hear if any of those are a space to watch.
Yeah. You know, like as you said, one of the beautiful things about Africa is that, I mean, yes, it's beautiful. I'm saying using that word just because right now we know that in Africa, we have experience with infectious disease. So we do have the tools, we do have the experience, we do have the knowledge in the continent about how to fight for infectious disease. And because of that, that's where the opportunity that I see in the continent, and for our doctors, for our scientists, for our researchers to work together with the government and providing an effective and agile response to this pandemic. We also know that our health system is really very ill prepared for, you know, like an increased number of tests of patients being positive, or even an increased number of cases in the continent. So what can we do as a continent, and what can our scientists do? Yes, we do have the platform of HIV that is in many countries like South Africa. And the beautiful thing is, like, that panel can be used also to help with the COVID-19 testing. So if we combine having this platform in those countries, having the knowledge, having the experience that our doctors have with Ebola, with, you know, all sort of infectious disease, that's Africa, we have that opportunity to actually step up. You know, you talked about Senegal. Yes, it's wonderful that the Institut Pasteur de Dakar is developing that test of $1 test for everyone. I mean, if we are able to harness that and getting the public, private sector, the government to support that, I mean, not only you are helping, you are making the test accessible to everyone in the continent, not only just for Senegal, but also for the rest of Africa and even the world. So I see this as an opportunity really for the continent to step up and just like really actually lead the way in terms of like how do we address this, and leveraging the experience that we have with infectious disease. We have so much more experience in the continent than any other part of the world.
Yeah, that is very true. Josh, I want to within the same spirit of the question, but I want to tap into your digital health background and what you're working on. Again, huge opportunity for the continent to take advantage of the infrastructure that is already in place with access to telephones for you know, financial services, for instance, right? Companies like INSEPE have been doing this for a long time, but access and use of telephone provides an opportunity for healthcare. So again, with your background, really curious to hear whether this is another disruptive technology that allows us to go into the next step and have access to telemedicine to at least address some of the healthcare needs.
Yeah, no, I think absolutely. It's interesting because there's some programs to what Dia was saying in terms of from HIV and other areas that have been learned or lessons learned. It just needs to be dialed up in Africa. To give you an example, it's similar here in the US, Text for Babies, Mom Connect in South Africa. These are things that have been used in the past through text messaging and being able to connect almost communities with healthcare workers and be able to get advice to prevent HIV transmission from a mom to a baby. And that has been very successful in places like South Africa, which companies like J&J and others have supported, but now it's fully run through the government, through a nonprofit basically, because it's not supposed to be trying to make money off of it. But the idea is that being able to give moms that are, especially expecting moms that might be HIV positive, full access to data and information. And when they have questions, to be able to access healthcare workers, regardless of where they are within South Africa, or it could be within the continent, or could be within the world. To have that access has been very successful. I think what's missing today is it's no longer, you need to take it above just one country or one city experimenting with it. It's like, can you do it across sub-Saharan Africa? Can you do it across all 54 countries? Can you develop a model that allows you to test some of these things? To give you an example, I met an entrepreneur. She went to Johns Hopkins. She started a company because her grandmother had cancer in Nairobi. And fortunate for her, she's able to move her grandmother to the US and get the surgery and all the treatments that was needed. But one thing she realized was there were only probably about 2 or 3 doctors that they can talk to within all of Kenya, which is impossible. I mean, to actually have just 2-3 people manage a whole country. But since then, what she's been looking at is basically how many doctors that are actually experts in that specific condition exist around the world, but they are from Kenya. And what she found was just incredible. The number of doctors in the US, in Europe, and Australia, just around the world that are originally from Kenya, all of them basically willing to consult, which means that if somebody has those situations in Kenya and they're not fortunate to be able to travel to US or to Europe to get the treatment they need, at least they can get access locally through through digital health. I think that's going to be key moving forward, is getting a lot of governments to recognize that, by the way, you're not going to be able to scale the number of healthcare workers as much as you need, which means that can you start leveraging all the different doctors that have background. By the way, it's not limited to just Africans in diaspora, but it could be Friends of Africa there's a lot of incredible people that have no pretty much blood connection to Africa, but they are connected because they want to do something in their life. So I think there's an opportunity to just continue to build this network of healthcare workers from around the world to be able to support digitally a lot of the things that need to happen, and especially on things like infectious disease, just knowing how to prevent it. How do you actually, can you do the test at your local clinic and send the data to somebody that's an expert? Because you're not going to have infectious disease experts in every city, in every place that you need. So I think it could be a true disruptor. There are a few things that need to change. Technology is already there. It needs to be organized. I think it requires some of the government policies to change a little bit, to say it should be much more about collaboration and giving people access than the bureaucracy that's needed today. It's almost impossible for any physician, unless it's emergencies like this, to actually support someone. Even here in the US, I mean, you're limited to the states that you have license to practice. So there's an opportunity to actually let people expand and use humanity to actually answer the questions through technology.
Yeah. I mean, go ahead, India.
Yeah, I just wanted to add to what Josh just said, and if there's any place we can do this, is actually in Africa. And I totally agree with him. I recall, we have like so many African experts outside of the continent with all different therapeutic area. And they do have that expertise. Unfortunately, they don't have the structure necessary for them to practice in the continent, but they're willing to help. I know a lot of them. And so that digitalization, in order to make that happen, the African continent, everybody has a cell phone. If we are able to harness that, and also working with the telecom company, the government kind of like putting the policy in place, that connection between the continent and outside of the continent will be such a disruptive effort, and that can lead to great outcome, to like increase access to this by using the tools. And everybody has 2 phones, so I think there's an opportunity, even in very remote areas. You go to the village, 60 kilometers from the city, that phone is there. So how can we leverage digitalization to connect those people so that they don't have to actually find ways to come all the way to the city to get treatment? I think this is the opportunity that requires, a partnership between the private sector, the telecom company, the government from a policy perspective, and put that all together to be able to have that increased access. So this is where I see the opportunity right now for Africa to really step up and respond. But again, the urgency is there and we need to act fast. This is a pandemic, so like all of the bureaucracy maybe need to be put aside and require that Pan-African effort and working together to find this type of solution. So I think I totally agree with Josh. Digital is the way to go right now.
Yeah, I mean, it does address, I wish we had all day to talk about all these, because we've touched upon the issue of brain circulation, right? Regardless of where you are, at the end of the day, you are a global citizen and you have an expertise and a talent to contribute. And technology provides that avenue. So that's a whole new conversation that we can have, hopefully a different day. It does bring the issue of innovation in all its forms. It's not just innovating the tools and the testing and the therapies and the vaccine, which again, it's a whole new conversation that we need. And there is global collaboration like never before, but there's also like systems innovation and process innovation that both you and Josh have touched upon. Like, how do we take these bureaucracies that currently exist to allow telemedicine to be border-free, and so the population that we hope to touch could benefit from these things. So these are all great conversation that I'm sure we will continue, today and for weeks and months to come. I want to move very quickly, since I'm also keeping my eyes on time, but around what does it take to get out of this situation, right? So we've talked a little bit about testing. Eventually, we need to have vaccines. We need to have the drugs that makes people feel better once they're sick, and of course, preventive vaccines. Here in the US and in Europe, we're starting to see clinical trials taking place on various fronts, whether it's to test existing drugs, to repurpose them, or whether it is various ways of tackling the vaccine issues that under normal circumstances will take years to develop. And so all those, so I think, DA, this is maybe a question to you, and I'll ask Josh to comment as well. With, I believe the current rate of clinical trials in Africa, 2 to 3%. I'm going from memory, but I don't think I'm wrong. That obviously need to change, right? We cannot wait until drugs are tested in the US and Europe, then to be tested in the African population to see what works. And so, and many people, including my own organization, is thinking very, very seriously in bringing coalition to do mirror clinical trials. just wanted to hear your thoughts, because we already have fantastic people, including the communities of African genome work, right? The H3 Africa communities who've been working on these issues, on genetic research for quite some time. Want to hear your thoughts. Again, opportunity for African scientists to innovate and do these things in their own terms and in their own terms, and using their skills and talents to really bring the therapy and the vaccine that the world needs into place. So your reaction, DA?
Yes. Oh, can you hear me?
Yeah, I can
Yes.
hear you.
Sorry. Like you said, we have many doctors, many scientists in Africa that have had this global training experience and came back to the continent to work. And yes, there's a lot of effort right now, even from a genomic testing with the H3 organization that you talked about. The opportunity that I see is that if you combine our experience with infectious disease, the experience with running clinical trials outside of the continent, I think this is an opportunity for our African doctors to really get together. And I'm going to go back to what I said earlier in terms of like a pan-African effort. If we put our mind together, all of those powerful mind that we have combined with the experience with infectious diseases, I think we can even inform the world. I was talking to a friend of mine yesterday, and we were just talking about what can we do? When in Africa, you don't see many clinical trials, global clinical trials coming to the continent. Why? From my experience and what I've heard is that, there's always a perception that we do not have the right infrastructure in order to actually run a proper clinical trials that will be really acceptable to all of these health authorities such as the FDA or EMA. Then where do we start? And in my mind, I think what could be done is really start with the capability building. Like what does it need from the nurses, from the pharmacists, and all the healthcare professionals within the hospital setting? We have example of great hospitals in Africa, like in Kenya, in Ghana, in Nigeria, or even different places like in the continent, right? And in Ethiopia, right? How can we just like develop those skills like a GMP, GCP training? All of that needs to happen and bring that capability to the people in the continent in order to be able to do that, because there is so much we can inform the world about this particular disease. Yes, like if you see right now, it's a blessing we don't have as many cases in Africa relative to other part of the world like the US. And if you see, even if the number of cases increase and with more testing, you have more cases increases, the ratio or the ratio of death is really small compared to other parts. Why is that? I think it's a question that we can answer as a continent. Why is it that different in Africa? So if we put together, like all of those great minds and provide the capability training in the continent, I think we are able to show the world that actually we can even develop our own clinical trials that can not only inform the continent and how do we react, how Africans react to this disease, what's in it, and also inform the world. And this is really, I think now is the time to really step up and also like having that opportunity to really take the lead in this particular situation. So definitely, I think it's that capability building and also getting together. Not only one country can do it. I think it's all about that collaboration that we need, and also having the government support from a policy perspective and removing the barriers that can enable and bring in the resources, because this will require resources. So if we have like a possibility of pulling the resources together and supporting this scientific effort, I think we can just make leaps and really disrupt the course of this disease.
Thank you. So in the interest of time, Josh, I'm going to come to you and completely change the conversation a little bit so we can touch upon other things as well. So it's the issue of comorbidity, right? So here in the US, we are reading and learning that disproportionate impact of COVID-19 on African Americans and other people of color. And this shows the trend of existing conditions such as diabetes and obesity that is affecting people in low-income communities and community of color. So I'm hoping that Josh, you can talk a little bit about communities here in the U.S. and what, if anything, we should be doing as members of the communities and global citizens before we start moving to other comorbidities that are affecting in Africa as well.
Yeah, I think that's a very good point in terms of just the disparities that you see in terms of access to healthcare. It's interesting because it's easy for those of us who grew up in Africa. We've seen what goes on, but it's not to the same level where it's just people don't have the resources, don't have access, those kinds of things. And you have places like US where there's significant disparity and socioeconomic issues in African American neighborhoods. It's interesting because you look at places like Chicago. I mean, this is one of the biggest cities in the US. And it's almost 70% of people that died so far from COVID are African Americans. And this is mostly, at least some of the initial data shows that it is different heart conditions, it's different diabetes, different conditions, comorbidities that actually exist, which brings up the question, before even COVID happened, these people had no access to the basic treatments that are needed in countries like US. There are a lot of them don't have insurance, a lot of them don't have access to the doctors that they need to take care of even what issues they have. But some of it is also mistrust, not willing to just go see a doctor because it's not somebody in their neighborhood, it's not someone that they actually are familiar with. I think this is definitely exposing a lot of other issues in the US. And unfortunately, I wish I could say we're fast learners here in the US because a lot of these kinds of issues come up, and then as soon as it slows down, we move on to the next big idea because of either politics or a lot of other situations. But I think the healthcare piece, even in the US, needs to be addressed, especially in those kinds of communities and neighborhoods. That basically says you need fundamental, very basic healthcare and screening of people and giving them the right medication for simple situations like diabetes. And I don't want to oversimplify it, but it is things that can be taken care of. Heart conditions that it's pretty sad to see, but unfortunately COVID is the one that's exposing the effect of it, because before any of this, I don't think a lot of people actually were even aware of the impact of healthcare and lack of healthcare that exists in some of those neighborhoods. That's becoming very evident right now. I think part of it is, by the way, this applies to Africa also. I can talk about mobile phone access and other things, but there are still communities that don't have full access to the information, to everything else, whether it's here in the US or in Africa. So I think it's going to be important that governments, local communities actually make that part of the priorities as we move forward. But in the US, I think it shows as considering the amount of money that goes into healthcare, considering the resources that US has, still is struggling to address some of the most vulnerable that you would see in places like Africa. And I think this is going to be key in terms of what we do with it. For Africa, it's a little bit different in a sense. I think governments are going to need to do a little bit more. If you look at the healthcare expenditure, education expenditure, just the basic needs for societies to be successful is not fully there. So there is an opportunity, but it can be done through a collaboration. It doesn't have to be one country trying to solve its own problems. I think Africa is very unique with the 54 countries. There is willingness. We see it in the African Diaspora Network doesn't matter which part of Africa you came from. It's just people are just ready to help, ready to collaborate. And how do we take that thinking? How do we take that collaboration broadly across Africa?
So true, and you know, another happy outcome of this in my mind is also, again, as we play a dual role of citizens here in the communities we live and citizens of Africa, what are the innovative ways to address a broken healthcare system regardless of where you are? A healthcare system that is funded. So it's clearly no lack of funding here in the US. So some fundamental big problems are caused. And then you go to places in Africa where funding is not existent, but we still don't have a working healthcare system that works for its citizens. So interesting, two opposite issues here in play, but there are interesting ways to perhaps go at it and bring a global citizen approach to fix a broken system both here in our two homes, regardless of where we are. So again, in the interest of time, I know there's so much we can talk about just in what Josh has said, but Ndiye, I want to move to you to issues of, again, that affects disproportionately women and girls. We know from past experience and past infectious disease and pandemics that women and girls are affected more, whether it is because it's our various roles as caretakers or heightened threat of domestic violence at home, or just in general, women taking bear of heavy burden in situations like this. So gender equity and equality has to be built as part of our pandemic response to COVID and future pandemics. So Ndiye, to you, any thoughts that you would want to share just to even bring the issues to light? So as we struggle and figure out a way to address these multi-pronged approach to this crisis, that the gender equity stays front and center as women are really the nucleus of their families.
Absolutely, and it's such a very important point, and women has such a great role to play. I mean, even outside of a pandemic, we know the women are in the forefront, even if it is not in the healthcare system, like the nurses, the the housewives, like even from a teaching perspective, in the school, taking care of the kids, taking care of the family, taking care of the elderly, the women are in the center. So in a case of a pandemic, when you see, now everybody is at home, the sheltering in place is forcing women to actually stay home, maybe with an abusive partner. So you have an increase in domestic violence. We also have seen from past pandemic, like for the schoolgirls, they leave school are closed, and even when everything goes back to normal, the girls don't go back to school. So that creates that disparity. Even from an income perspective, like a woman, like a teacher now she has a job, now she's at home with her kids and trying to still do her job, but she's worried about whether I'm gonna be getting paid. So there's a loss of income, a loss of job, and a lot to worry about. So I think as we think about solving this type of issue, is putting together policies that take into account the responsibility of the woman in the society, and as well, so we're going through this pandemic, is so important. Like whether it is like psychological support, whether it is like funding, whether it is we see, like even from a domestic violence perspective, in time of pandemic, you see all of those resources that were used before to support women now are reallocated to something else because we have a crisis in our hand that we need to resolve. how can we not forget about those, big challenges that women face in case of a pandemic, and give them the support that they need. Can you hear me?
Yes, we can hear you.
Yeah, and give them the support that they need in order to continue supporting our families, continue taking care of our elders, and everything that we do, being in the forefront of like a caretaker. So I think from a policy perspective, or even globally, as you think about the crisis, that gender inequality needs to be addressed and helping from that sense. Otherwise, I think we have a bigger problem in our hands. Really, it's really very important.
Yeah. Josh, 2 minutes
Yeah.
to answer a giant problem.
Yeah, no, it's interesting because I think these are things that not just on women and girls, but also to make sure that all the progress that have been made in Africa, whether it's on maternity, on just making sure those things are not lost in this situation. It's very easy, everybody, to just focus all the resources on COVID and go back into some of the things like maternal health and other things that have been done, with all the progress to make sure that we don't lose that. But there's small things that I think everybody should be able to do. To give you an example, at least in my side, there's one on the digital health, which is what I focus the most, but I also run a company called Small World that sells products. So we have a brand called Nuria Beauty, which is skincare products. And what we've made a decision on that was, this actually since we started it over a year ago, that a percentage of everything that's sold on that brand has to go to girls' education to be the first ones to finish high school. So we've been donating quite a bit of that money just to make sure that's not forgotten. And then this month, what we're doing is 100% of everything we sell in this month of April for Nuria Beauty is actually going to save the children. And we had quite a bit of discussion to say, by the way, a lot of money is going to go into COVID, a lot of resources are going, but there's small things that each individual could do to make sure that, it's interesting, everybody's talking about how remote education is working right now for kids staying at home. I'm like, imagine how many kids don't have laptops in their home. So how do you do remote education when you don't have the access that you need? And there's a lot of companies here in the US that are trying to help with that. But you got to think about it in Africa. If schools are out, majority of those girls are going to go back to getting married at a much younger age, which there's a lot of progress made. But those are the kinds of things I think should not be forgotten. But this is a good example of things that individuals could just continue to remind everyone and do small things to help. And there's a lot of activities. Last second is, I think what I wanted to, it's interesting watching the chat that's coming up in this discussion. I have to say, this is a good example where everybody is seeing things happening in different parts of Africa, but none of it is coordinated. And I think this is going to be key in terms of as we move forward, some of the lessons learned. I see all of that. It's like, wow, there's just incredible activities going on. There's a lot of progress being made, but nobody is actually putting it all together, especially in this day and age where technology could connect all of it. I think there's quite a few follow-ups to do as I see the chats that are coming, because there's a lot of work already, great work happening. And how do we bring all of that together so that it's not just limited to one city, to one country, but how do you leverage that across all 54 countries?
Yeah, for sure. So I think we'll come back at the end before we close to sort of think of how to organize ourselves to put even thematic areas, whether it's working groups, whatever it is that people feel will help. So we'll come back to that. So we're going to try to take some of the questions, and Rebecca did a good job of putting them in thematic areas for me. So I'm going to try to address them. So forgive me as I try to read through and put the questions to my two panelists. So the first area is health systems. So people are saying, what efforts are being made to better navigate the political and social climate to deliver effective healthcare in African countries? So finding the innovation is one thing, delivering them is another. So the usual delivery challenges. Along that line, Tadissa says, healthcare affordability and accessibility, it's fine if we have a vaccine or drugs, but if we don't have access to the most vulnerable of our society, that's not going to do much. And then Beth Nagash also says, yeah, so exactly what you just said. Let's not forget other things that are happening while we combat COVID, whether it's child mortality or maternal mortality and morbidity. So health system reactions to both the health system questions, but also existing problems that we had before COVID, that the world has put in effort to get rid of them so we don't forget about them as well. So 2 minutes each, please. Health systems reactions. Josh.
Yeah, I think you know, it's interesting. I spent quite a bit of time in the last 2 years in Africa. It's interesting because it's country by country, it's very different. You got countries like Rwanda who are taking responsibility. You can argue about politics anytime you want, but you got to give them credit in terms of their willingness to actually bring better healthcare to pretty much their whole population. They're actually being very aggressive in collaborating with companies, big companies in the US and in Europe, to bring them into Rwanda and say, here's the mental health issue, here's the areas that we have gaps, and we need you to help us figure it out. I think we've seen it in Kenya, we've seen it in parts of South Africa, we've seen it in Senegal. I think this is going to be important. Unfortunately for Africa, in some areas, there are governments that are just not going to allow anything to happen in those countries. But I think the more the population sees hope in terms of what Rwanda, Kenya, and others are doing, I think the better the continent would be. But there's also a responsibility for a lot of the diasporans that are from those countries to start demanding better access in those kinds of situations, better collaboration. But seriously, if people are not following what's happening in Rwanda, in Kenya, at our last Addis meeting, the minister from Nairobi on innovation from Kenya was with us at the African Diaspora meeting, and he was talking about, he's an ex-Google guy, knows technology. He was saying, okay, I need to do more. I need to bring this to my people even more. So I think this is going to be key, but there's a big opportunity for the diasporans also to play a much more active role. Just the last thing I would add is, I think it was last week, I was talking to my brother who also runs another business, and he said, oh, I just got off the phone on a call, and it was actually a call that different African countries, the embassies were doing updates to different population within the US, saying this is what we're doing, these are the things that we could do. So how do you magnify that and do it Pan-African, not just country by country, because there's a lot of lessons learned in terms of what's working. The same way that in the US, we're seeing some states are doing a much better job than others. Obviously, we have the media that actually amplify a lot of it that doesn't exist in Africa. So how do you take those lessons learned and apply them so that, because people don't need to reinvent everything, there's always a solution that's already invented.
Yeah.
Yes, and I agree with everything that Josh had just mentioned. And I also believe that, you know, like countries like Rwanda and Kenya that are, you know, just totally like on the other side of the spectrum in terms of like the willingness to sit down with the health sector, the WHO or other organization to actually find a solution in terms of like developing this effective ecosystem in the healthcare sector. Now, how do we scale that across Africa, right? So yes, there's the government willingness to sit like in these two countries to work and finding solution for the population. My thinking is that maybe we can leverage the African Union, right? And how can we see those pilot countries, you know, like this very success, and what lesson can we take from there, and also to like to bring it to bring the other part of the continent together, and having this Pan-African effort that we talked about earlier, in order to like boost the health system in Africa. Because currently, right now, we know that how difficult it is, and we are not prepared for an increase in number of cases in Africa. Then this is our opportunity, really. It's like leveraging the African Union, learning from Kenya, Rwanda, even Ghana. I've been to Accra, and I've seen, the effort that actually the government is willing. So that's where we start. We need to start the government willingness to actually address this, using the experiences from the other countries and putting it together, really to have like a Pan-African effort to boost the health system, so we are prepared for the next one, because this is not the last one that will happen, but at least how can we be prepared together and make this effort. And the diaspora, I agree, the diaspora has a role to play. I also think that it has to be in a very organized way, right? Because everybody has like different skills, different ideas, and work in different sectors. How can we organize ourselves? And I think we'll be much more powerful in terms of influencing the governments and also demanding those, those efforts in the healthcare system.
Yeah, so true. And really, there are some really exemplary programs that are happening in African countries. I mean, somebody touched upon what's happening in Kenya, but there's an interesting model in Ethiopia that actually has been put in place a long time ago, is putting healthcare workers as the front line of fight against any disease, not just pandemic, but any disease, including maternal and child health issues. And I believe, if again I'm going from memories, but that has been put by Dr. Tedros when he was the Minister of Health, I believe, is training 300,000 healthcare workers to be the soldiers on the ground, to be your first line of defense for healthcare for your population. How can we learn from things like that? Not only address the healthcare issues, but also put people to work, right? So there is this huge thing that we didn't even had a chance to tackle. Issues of economic impact that we don't currently quite really understand or process, right? So what are these different things that people are doing and countries are experimenting with that we could use as models to try to replicate them in other similar landscape? And it would be a really interesting space to watch for. There was a question that was asked earlier by one of our participants around not neglecting other areas. While we fight for COVID, there's polio, right?
Yeah.
We cannot neglect it. It's sort of under control, but it's there. It's not dead yet. We need to defeat polio for once and for all. How do we make sure that doesn't pop up again, right? Because it's not gone yet. There are issues of women care and child's and baby's care. So I think we should spend a few more minutes to talk about these fundamental issues that are already problematic on the continent. And then you add COVID, and our attention shouldn't be just on COVID, but to make sure that these underlying problems are not forgotten. So I want to come back to you, Josh, to talk a little bit about existing conditions that shouldn't be forgotten.
Yeah, and I think this goes back to my earlier comment. I think there's so much progress made already. I think, granted, it's probably at different levels between different countries, whether it's maternal health, it's child mortality, to make sure that most children actually make it to their 5th birthday. I think that has been a big problem, but continue to see good progress. But Africa is going to continue to have some challenges, especially if you just look at, you don't look at the education system, at the healthcare system. To your point, it's like, are we training more nurses? Are you training more? It doesn't have to be just physicians. It's just healthcare workers that understand how to prevent an infection. I think you've seen it even in places like New York City, where there's pop-up hospitals in Central Park and other areas. that are enabling people to be able to triage so that you're not pushing all these people to the same healthcare system that creates more infections, basically. But I hope the way it was in governments in Africa or other places, it's the same thing here in the African American communities, to make sure that those things are not being forgotten and just diverting the funding and the resources into COVID while ignoring what took about decades to actually make progress on, that you don't go back on that. But I think it's a fundamental need. I personally think that most of these things need to get out of the political system and get into the health ministers, the education ministers of countries, and less on the politicians, because it's a different approach when a health minister who's worried about what's going to happen to their country after COVID will have a very different view than a politician that's trying to look what to do in the next election. I think this is going to be important for Africa and for the US to some extent, that let healthcare workers actually manage what needs to happen. The CDCs of the world, whatever the name, the ministers of health, I think can make a big difference as long as they have their population and their people's health and wellness in mind. I'm confident they'll do the right things. If it becomes political, that we see it in a lot of places, there's no solution for it.
Yeah, agreed. And there are really fantastic outcomes of the Ebola effort, for instance, right? Post-Ebola, there was the creation of the Coalition for Epidemic Response that brings together all stakeholders to work towards the next epidemic. CDC Africa, you just mentioned, is one of those happy outcomes post-Ebola. And John at CDC, they're doing an amazing job of organizing, a giant continent with different systems, with different capabilities, but to bring in a network of labs, hopefully, that would help in detection to begin with, and then obviously in treatment and prevention to go on. So Nadia, back to you. In terms of your experience both at Roche in the testing, just to bring it back again, in the testing of COVID right now, that we now have, I believe, more regional organizations and amazing leaders in those organizations in Africa that could be put in place even more. Like CDC Africa, WHO Afro, there are few that are taking fantastic leadership in organizing us and leading the way. And so as you think of Roche's tests in terms of diagnostics, how do you all work and coordinate on the continent to bring these tests not only to those who can pay, but also to those who cannot pay, but they are vulnerable and needs just like any of us?
Yeah, absolutely a very good point. And, like I mentioned earlier, the testing has been made available to everywhere in the world. We're producing like a million and million of tests per month. And that testing is so crucial because this is what will eventually protect the population in Africa. So we have the platform, we have the test that is going into the continent, and we need to make sure that once it gets there, it gets to the people who really would need it. And it's not just about who can pay for it. We have a lot of access program in the continent where people can have access to the test. Now, how do you get that done? Because the entire world is looking for tests. There's not enough for everyone. So, but then from a supply chain perspective, the company is continuing to produce and then dispatch it wherever we have our platform so that people can have access to it. Now, if you see what's happening currently in the continent, the testing, the guidance is really to test those that will come and present with symptoms. And if they are tested positive, then do that contact tracing to figure out, okay, who else has been in contact with them, to be able to kind of isolate them maybe for a couple of weeks to see whether, they have been exposed or they're not developing any symptoms. So those are the things that the company does, and is to just like make the test available to everyone. But I think, from that standpoint in Africa as well, it's just like, how do you manage that in the continent and protecting the people? And if we want to avoid funding from other disease like polio, cholera, and not to forget about it, I think is that the number one thing, in my opinion, is really to protect the population and try to contain this epidemic. So I think, it's a public-private partnership. Yes, the pharma companies, but also the government willingness, and how do we organize ourselves in the continent to make sure that everybody who deserves access to it can have access to those tests as well.
Yeah.
But that coordinated effort is important, I think.
Yeah. Thank you. I mean, testing continues to be a problem, continues to be shortage everywhere, not only in Africa, but here in the US, in everywhere. There are lots of chats I see around somebody who said, there are no tests in Nigeria, not enough anyway. The CDC Nigeria has been asking for test kits. So these are things that really require a global movement and a global partnership of public and private and philanthropists as well, to really make it accessible and reliable tests.
Yes.
So we can use it to really inform our next steps.
And if I may add to that as well, like we see example, like for example, the Institute Pasteur of Dakar, they are putting, creating in collaboration with a company and in the UK to develop that $1 test. What can we do as government instead of like, I think the mindset of always waiting for the Western world to bring the solution to us, this is our opportunity to really leverage those efforts that is being done and support it as a continent, not as a country. Because I don't think the solution is into individual countries, but I think if we see those examples and how can we come together and bring that effort just like really to boost the development of those tests and make it accessible, because that's a wonderful example. That's something that could work and that can help the entire continent, so we can protect our population, but also even like supporting the rest of the world. So I think those efforts is really to help encourage those innovation and also those efforts as a Pan-African effort. That I think that really will make a difference in terms of like increasing the testing, and then we don't have all of these issues with people looking for tests. Because to your point, the test is being sought after everywhere around the world, so it makes it really very difficult.
Yeah. Josh, do you want to comment on that?
Yeah, no, I think the only thing I was going to add was basically, it's interesting because the more you see it, even here in the US, this concept of government is not going to solve this, companies are not going to solve this, individuals are not going to solve it. So it's this partnership that's absolutely needed to make this happen. It's just, you almost have to move away from, I think we're starting to see it here in the US, despite of all the political issues that exist, what the private sector is doing, taking responsibilities, what NGOs are doing to make sure that, whether it's Save the Children and many other NGOs that are doing to make sure that the other people are not forgotten that don't have COVID. But at the same time, whether it's diagnostics and other things that need to be developed, whether it's a $1 diagnostic, how fast can you scale that? That can only be done in collaboration with private sector. So how do you actually take that? And I think I would love to see, with all the dire situations that are being highlighted by health ministers, they should be calling a lot of the private sector companies to say, I have a diagnostic that I think it's going to be ready in Dakar. So how do I scale it? How do I produce 10 million of it? And you're going to help me do it, because you see some of the amount of money that's going into clinical trials and others. But there's definitely short-term needs on diagnostics, on testing, on access, even the PPE issue. But now we're starting to see a lot of companies just can convert their production lines into making mass making. We've seen that in Nigeria and other places. I think those are going to be key. which is how do you mobilize the private sector, governments, NGOs, and I personally think that the NGOs and the private sector could play even a much bigger role in addition to what they're already doing.
Yeah, yeah. And it does address, you know, multiple issues. First of all, local solutions for this problem is key. So you don't have the issue of logistics to move things around, right? And it does put people back to work. I mean, at the end of the day, you know, we are grateful for our jobs, but not everyone has that luxury. And it is even more important in places like Africa and South Asia, where people have limited, you know, choices and opportunities to provide and feed their families. So innovative companies like the ones we've seen in Kenya, where I think they were making, prior to COVID, they made suits for gardeners, aprons and stuff, and the woman just completely changed everything, and they're providing now thousands of masks every week, not only for Kenya, but hopefully it would cross borders as well. So it would be nice to see innovative ways of addressing both, right? Addressing the current issues, but also putting people back to work.
Yes.
So yeah, please go ahead.
Keres, I just wanted to add something to what you just said. The local solution, because we have the resources in the continent. Excuse me. When you see, for example, when you talk about the PPEs and the masks, the continent has, you know, everywhere you go to in Africa, you have a tailor somewhere, right? And if it comes to like developing PPEs or masks, how can we leverage those skills that we currently have and show them a model on how to do it and put the infrastructure in place to help them actually develop those protective equipment for our healthcare workers that are in the front line of this? Because it's such a simple thing to do, and we don't need anybody to help us. It's just a concerted effort that can help others and also protect the population, so that we can get out of this. Because I really believe that Africa, our number one thing that we can do right now is to protect the population and contain this. Because we don't want it to get to a point where the number of cases increase and our health system is overloaded. And then we're going to have, because we all know that we're not ready for it. So the prevention in the beginning, I think the effort should be put into that and leveraging our local resources as well.
So thank you so much. And I see lots and lots and lots of questions on chats, which is fantastic to see. So we're going to have to figure out how to address all of them after the fact. For the last half hour, I really want to focus on what do we do now, right? Where do we channel all these energy? And for all our participants, maybe you don't know that both my panelists are board members of the African Diaspora Network. So I'm going to put them on the spot, since I haven't really prepared them for these questions. But as board members, it would be great if you could help us figure out how to come up with a way to organize ourselves. So both the diaspora, but also Friends of Africa, who have immense experience and wisdom to share, because they either lived there or they have an interest or they work there, to come up with innovative ways to get ahead as much as we can. So we need leadership to help us get organized so we can channel this energy that we see as part of this hour-and-a-half discussion, as you see in the chat. So forgive me for putting you on the spot, and we won't hold you accountable to the first reactions, but it would be great to hear, like, where do we go from here? How do we organize ourselves? Like telemedicine, Josh, for instance, lots and lots of questions where people I see a big opportunity to use telemedicine and the technology to solve a lot of the issues we're talking about. So maybe I'll start with you, Josh, and Dee, I'll come to you.
Yeah, I think, first of all, looking at a lot of the discussions that are happening in the chat that I've been reading, there's a lot of people that want to do something. I think that's an incredible start, and I guess I'm not that surprised. It's always, we see this is just an African culture. When people need help, everybody jumps in, and we see it around the world, the same, similar thing. So hopefully we'll continue to capture those, and the people that are actually saying, here's some things that are happening, here are some of the things. So we got to figure out where this discussion continues. But in the meantime, I think there's a couple of commitments that are going to need to be made. So for me, on the telemedicine side, seriously, we could develop a telemedicine platform tomorrow. It's already exists in China. I mean, China at a much bigger scale because it's trying to address a lot of population. It exists in the US. So how do you actually almost take the same platform? And then the question becomes, how do you access healthcare workers across the continent and people that are outside the continent that are actually want to be available to help? We've seen this work in some countries. So for me, I think that would be an incredible start, is to make this telemedicine platform available to physicians, and not for profit, but more just make the platform available and see how many doctors are willing to sign up, how many nurses, to become almost that conduit to give information to people, and in some cases to be able to help people understand what's going on. I think that requires then overcoming some of the country level bureaucracy and issues that might exist, but hopefully COVID might be a good reason to we're seeing this from a lot of governments, having that flexibility to say, okay, we'll correct some things later on, but let's give people as much access as possible to information. So I don't know if people have seen COVID.md, which is just a bunch of physicians here in the US that just started a company. Basically, they put their own money, but those platforms are available. So we need to find a way to make it available to Africa.
Okay, so we won't hold Josh accountable to work on that since I put him on the spot, but it's a really good way of thinking about it, and maybe come back to it in some forum to put together folks who have the technology background that could actually build those platforms, and folks who have different talents and skills and training to staff them. And that's that would be an incredible outcome if we can get to something like that. So I guess more to come, and more discussion for that. And Dee, you?
Yes, I'm going to go back to the protection of the population, because I strongly believe that to protect the population, we can decrease the risk of an increased number of cases in Africa. And when you talk about protecting the population, what I'm noticing, at least, from my friends that I have across the continent, what's going on, is how do we help people really understand what's happening and get the right information so that they are empowered and understand and that we need to take this seriously, and giving them that awareness and the information, that the right information, because currently right now there's a lot of fake news around this, unfortunately, with the internet. Then one thing, simple thing I was thinking about, speaking of the talent that is on this platform, that everybody has different skills, is there a way to work with, like the telecom company, again, leveraging that cell phone that everybody has in Africa? How can we push information, whether it is reminders, simple things, wash your hands, protect yourself, or these are the symptoms that you should look for when you, so that you can at least be able to connect with whoever. Like, for example, Josh was talking about the telemedicine, having that platform. If we have on the phone an app that can tell you, okay, what symptom to look for, and we can do it in different languages. Africa has multiple different languages, but we can start somewhere where we have that combination. If I develop this symptom and I have this platform where I can get access to a doctor, maybe I can get more information that will make me feel empowered, and I need to go to the doctor maybe, or even like I heard that in North Korea or South Korea, they have like an app where you are able to trace the people you have been in contact with once you develop the symptoms, so that they can easily get access to those and isolate them. I believe that this ADN and all our members, there's so much talent, so much technology in here that we can leverage in order to develop those type of technology, at least to protect the population and give them that awareness of the disease and how important it is to take it seriously.
Yeah, yeah. Well said. So I would like to wrap up this conversation, but I want to thank both the panelists and the organization to put this incredible, really information exchange at this point. As I've said, we could have spent a full day talking about just one of those issues. We jumped around from topics to topics because really this is a start of a conversation that I hope will continue over the weeks and months and years ahead. I neglected to say to those of you who are on the phone, who are frontline workers, we are incredibly grateful for what you do every day. It gives us the luxury to stay home, knowing that if we're sick, we can come and visit you, and we're very, very grateful for that. A reminder that it is World Immunization Week. We don't have vaccine for COVID, but we have vaccine for a lot of killing disease. So please help spread the news so we don't neglect some of the existing conditions that are killing people by the millions even now. And that in the fight of COVID, that immunization also continues even more now, so we can protect the vulnerable and ourselves as we figure out how to fight COVID. As our conversation has highlighted, obviously, a global crisis that it will require exceptional global cooperation and resources than any one country or any one organization can give. It's going to take billions of dollars from all governments and organizations to fight this thing. We need to stay engaged. As Ndaya has said, lots of not true information circulating in the web and around us. So the way to do is to be informed, based on science, based on facts, and do our part to do what we can to inform people about the fact in the public health policies that would help us get through all these. In the face of this challenge of this scale, I know that we could feel helpless because it's really hard, right? You just don't know what you can do as an individual to help. But we also know that we can work together and rise to the challenge as we have before. And not only to address COVID, but as our discussion has also made it super clear, there are various ways of being innovative and changing the status quo to address not only COVID, but accelerate some of the other neglected diseases that are impacting our communities both here and Africa as well. So I want to say thank you so much. It's been an honor to be part of this conversation. Thank you to those who've called in early, super early, or are in the middle of your day or at the end of your day. We appreciate what you're doing in each of your communities. Stay safe, stay healthy. I would expect that we're going to hear from the African Diaspora Network on next steps, how to continue this discussion, but also how to capture a lot of the chats that I wasn't able to capture, and I apologize. It's really difficult to keep up with the chats and facilitate the discussion at the same time. But rest assured, they're capturing it, and more to come. And to help us close, I don't know, Almaz, if you are on the phone or on video, would love.
You can't see me. You haven't seen me all this time.
There you go. We can see you. So back to you, and thank you for everything you do.
No. Thank you so much, Idris. Thank you, Josh and DA. Thank you, everyone, for being a part of this discussion. I think just you mentioned that this is, it feels very difficult, very hard. But I think what makes it so beautiful about this community, and I'm going to talk about the African Diaspora Network community, they are here. Whenever we ask for a meeting, they're there. And so in this month alone, we have 3 convenings, and I'm very grateful for their participation. The work we do matters. We've been in existence for 10 years. We started as grassroots, just as an idea. What can Africans and Friends of Africa do? And then over the last almost 10 years, I am absolutely in awe of all of you, and especially the people who believe in what we do and have never really forgot where we started. And we started as an idea, and they made it a reality. They helped us make it a reality. So I want to say thank you to all of you on the Zoom call today. We had to pivot quickly. If I am able to do this, anybody can do it, because I'm a feel and touch person, but I'm really, really just enjoying even just being with you virtually. What this means is that I've been reading on the side, my eyes were moving around all the time on the chats, and there are questions about what is the African diaspora can do. Let me tell you what we can do. I did send you, and if you haven't received it, let me know. We have an online platform ready for you to have this discussion. We want to be able to continue that discussion online, and we do hope you do. And just go ahead, I gave you the instruction to join. But at the same time, I am getting, not only are we getting these questions from you on the platform, but almost every day I get emails, how are you going to activate the African Diaspora Network? And in fact, we do have a board meeting on the 30th. In 2 days, we will discuss exactly your question. I have no idea what we could do individually, but I do know one thing. We are all together, and we collectively will figure this out. And as Kadis said, we're going to come up with some action items based on the chats that we've seen, based on what we're hearing, and also based on our capacity, because it is not one organization or one person to do it, because this is a massive, challenging issue that requires, it's a complex issue that requires all of us coming together. But what I believe is that we will come together and we will make a difference. And the Africans in general, and Friends of Africa, they're very generous. We give. My caution on the giving is, what are we giving for? Who is benefiting from it? And how do we make sure that the very people we want to support are actually getting the funding? There's, as much as there is a fake news going on, there are also fake mobilization of money that concerns me. Every time you have a challenge like this, something pops up. And some of them, most of the time, are good, but the ones that are not good are going to hurt our community, especially those are very much disadvantaged in terms of getting information. I would encourage each one of us to do the best we can to support the community we serve. There's another thing I want to mention, because we have a few minutes, and I want to say this, and we are going to do a meeting like this in May. Remittances to Africa are going down. The reason they're going down is when those of us who have jobs in the United States or anywhere in the world lose our jobs, who is going to be hurt the first? The very people who depend on us to get the funding. This is global. It's not only for Africa, it's Latin America, Southeast Asian countries, and Africa. So it's the global community that depends on remittances is being challenged. What I would say is we have an opportunity to collectively work together and figure this out. Not just only to send remittances, which is what I've been asking for a long time, but to scale remittances so that we can create sustainable communities. Because remittances, as good as they are, they also create dependency. How do we overcome that dependency? I have no idea, but I still believe that we will figure out how to work together. With that, I want to thank thank 3 of you. Thank you so much for all that you do. I want to thank my team. Deborah, Caroline, and Yinka, and Dan, who have really made this possible. Everything we do does require funding, and I want to give shout out to the Conrad Hilton Foundation for making this possible for us. And there are other funders, we will keep mentioning them as the time comes, but this one is very special because we did get funding from the Conrad Hilton Foundation, and I want to shout out for them for their support. The last thing I wanted to say is, in terms of the next steps, we're going to send a survey questionnaire. We're going to send you the entire recording of this program. We're going to reach out to those of you who have given us your email address for next steps and maybe creating what Kadis was saying, how do we mobilize each other, not only on online platform, but even really something like this that we could do, not for now, but for ongoing, so we can create sustainable community of action. We will send that to all of you. And then at the end, I know we cannot do everything on our own, but I do believe collectively we can do something. And I want to thank each one of you. And I want to also thank the people who are making it easier for us to do what we do. And these are the frontline workers, like Kadis mentioned and at the beginning, the people that I've mentioned, those who have lost their lives. And my heart goes out to all of them. And I know you feel the same ways. Thank you so much. And I look forward to seeing you all. And I look forward to working with everyone. Thanks, everyone, and have a great day.
You too. Thank you.
Right.
Thank you. Bye-bye. Thank you. Thanks.
Thank you.
Thank you very much. Bye-bye.
Thank you.
Bye. Thank you.
Bye.
Thank you.